Hello everybody and welcome back to my YouTube channel. Is your menstrual period longer than 1 week that is so intense that you feel weak and you've lost so much blood that you cannot move, leading you to have what we call anemia, that's shortage of blood? Do you feel pressure or pain around your waist or your pelvis? Are you having frequent urination or difficulty emptying your bladder? Are you having constipation or backache? Now, if you answered yes to 2 or more of the questions that I just asked, then it is very possible that you have a fibroid. So stay with me to get everything you have to know about fibroids, what causes them, how you can manage them, and how you can avoid or to reduce your chances of having a fibroid. Before we continue, if you're new to my channel, please like, subscribe, especially subscribe and share. Thank you. A fibroid is a growth in the uterus or the womb. The womb is the house or the home where we carry a baby when during pregnancy. So a fibroid is a growth in this womb and occurs during the childbearing ages. Before the age of 50, up to 80% of women will have fibroids. It means it is so common. 80%, that's 80 out of 100 women will have fibroid before they get to 50. So you can imagine, like, fibroids are everywhere. A fibroid is not a cancer. Thank God. A fibroid is not a cancer, and it almost never leads to a cancer. It's not even, most research has shown that it does not actually cause or lead to a cancer thereafter. So no matter how many people may have it, thankfully it is not a cancer. Now, fibroids have various sizes. It can be as small as something that you cannot even see with your naked eye to as large as a football. And it can also occur in pairs or multiple, like so many occurring at once, or you can just have 1 or 2. Now, how exactly will these fibroids form? So we talked about the womb that carries the pregnancy or the baby during pregnancy. The womb is made up of muscles now. So this muscle now grows extraordinarily, like it grows more than it should, forming a firm mass that is sometimes rubbery. So when it forms this mass, this is what we call the fibroid. This is the growth that we call the fibroid. And one of the most well-studied causes of fibroids or uterine growth is the hormones that we produce are estrogen and progesterone. That's why so many women will have fibroids at the end of the day, because the hormones that make you a woman, the estrogen and the progesterone that are in us all the time, they somehow promote the growth of these fibroids. So during your menstrual cycle, as the womb or the uterus is preparing normally for fertilization and implantation to have a pregnancy, as this wall is developing, it's the hormones that help it to develop. So these hormones are the same hormones that will cause the wall not to develop very well, causing it to form extra kind of cell division and causing a growth or a myoma or a fibroid. And thankfully, that's why they'll shrink after menopause. So as we said, by the age of 50, up to 80% of women must have had fibroids. Now, after 50, for most people, most women, you get into menopause. Now, with menopause, there's a drop in these hormones, so they tend to shrink after 50. Like every other disease or condition, there are some people that are more at risk of developing fibroids. Yes, it can occur in every woman of childbearing age, but black women are topping the charts. We have an increased chance of having a fibroid. We have increased chance of having large fibroids. We have an increased chance of having fibroids generally. So we are supposed to be extra careful. Black women, no, that's okay. It can affect every woman of childbearing age, but when it comes to us black people, it just triples its skills. And if your mom or your sister had a fibroid, my dear, be prepared. Check up on yourself, because you can have a fibroid as well. You have an increased risk of having a fibroid if your mom or your sister had a fibroid. How can we prevent having fibroids? For what is what, maybe we should stop being female, because at least it will occur only in a woman. But since we cannot really control that, we can control other things. You should not be obese. If you're obese, you can have a fibroid. So what do we do? We should exercise. If you're eating too much red meat, too much of red meat is going to increase your chances of having a fibroid. What do? We cut it down. As women, we love meat, especially in sub-Saharan Africa, but yes, but we have to cut it down if you want to reduce your chances of having a fibroid, especially if your sister or your mother had a fibroid already. Those are some of the things we can do. Eating meals that are low in green vegetables or fruits or dairy products, we should try to, in fact, the best thing to this thing is eating a balanced diet. Then you add plus dark green vegetables like jama jama, or vegetables, or huckleberry. It's the same thing. These are just different names that I've called. So you can increase your eating of vegetables, fruits, and dairies. If you've noticed, for almost every disease you have to eat fruits to help yourself prevent them. So why don't we just make it a part of our meal? Always eat fruits as much as possible. You're helping yourself. You're preventing tons and tons of diseases, not only fibroids. Last and definitely not the least, alcohol. Alcohol is implicated in almost everything. Alcohol will therefore increase your risk of having a fibroid. Also, so many women have the question, when I have a fibroid, does it increase or decrease my chances of getting pregnant, or does it affect my fertility, something like that? It's very important to know that the fibroid in itself will not cause you to have infertility. Like, the fibroid itself will not be the cause of you not being able to get pregnant, but in so many cases it can cause the pregnancy not to go to term. It means it's going to disturb the pregnancy. You can have the pregnancy, but you're unable to keep that pregnancy to the time when the baby is supposed to come out, or the right time. So there are various places or channels where fibroids will affect your pregnancy. Now, before I get more into how the fibroids will affect your pregnancy, it's good to know that not all fibroids will need any form of treatment. Some of them, the doctor will just see it, and they will not even want to tell you. So I've seen people who have had echographies where they've seen some fibroids. They don't tell you because you just get worked up for nothing, although we actually have to tell you everything. But you should not be worried. If you have a fibroid that is so small, they can leave it there. You have your children, you have no problems. If you have a very large fibroid that is causing you to have those symptoms we talked about at the beginning of the video, they can try to do something. They can give you some hormones if you're bleeding so much, hormonal therapy if you're bleeding so much. In other cases, they'll actually stop you from hormonal therapy. Reason why you should always fall back to your gynecologist for any kind of treatment that you want. But you should know that not all fibroids need treatment. If you're having fibroids and you don't even know, then some of them are even accidental findings. So they'll go to look for something else and they say fibroid there. So not all fibroids need treatment. Some they should just stay there, while others will need some kind of treatment. Now, most importantly, fibroids and pregnancy. What do we have to say about fibroids and pregnancy? Fun fact is, when you have a pregnancy, most of the fibroids will grow alongside the pregnancy, because during that period, those hormones, oh my god, they are surging. So the fibroids is like they're having nourishment now. They're being nourished. So they'll really grow during the pregnancy as well. But to say they will cause direct harm to the baby, no. Now, if these fibroids are occupying some kind of space, maybe when the placenta is trying to attach in the womb, it can cause the placenta not to attach well, and you have like a disruption. Like it can break away. The placenta can break away when it's not time from the womb, causing something that they call placenta abruptio. So that is how the fibroid will affect it, and this most especially will be in the after 3 months of the pregnancy, second third trimester. That is when these kind of things will happen. That's why so many people with fibroids may end up in cesarean section for delivery of their babies. Notwithstanding, so many other people can have normal vaginal deliveries depending on the size of the fibroid. Another thing is pain. If you have a fibroid, some of this fibroid, they will twist on itself and cause a lot of pain. They become red, they eventually die, but during that whole process, it pains a lot. So you have pain during the early pregnancy, like first 3 months. You can even have miscarriages. So this is how it can affect. That is why your gynecologist or your doctor, your visiting doctor or your physician, some of them will advise that you have the fibroids removed in a procedure called myomectomy. you have the fibroids removed before you conceive to increase the chances of having your baby to term or to the 9 months. Now this what I've given you is the juice. It's everything you should know about fibroids. You don't need to panic, you don't need to be scared. Just go do your regular consultations, check up on yourself. If you want to have a pregnancy, you consult with your gynecologist, but you know that your chances are good, especially if you have just the fibroids. So many people with fibroids are out there having 10 twins having the number of children that they desire. Let me not say 10, that's hyperbole. Like, now, if you're here with me now, it means you watched my video to the end. I am so grateful. Thank you so much. And if you have any questions or comments that you like to make, please down there in the comment section. I am waiting on you. Thank you. See you next week for another video.